Suicide is considered a leading cause of death in the U.S., and that's why our state is doing what it can to make sure that those in need of help have access to resources.
And there is a push for training to make sure people are educated to know the signs if someone is in crisis. WSFA 12 News anchor Rosanna Smith continues our Under Pressure, Stressed Out in Alabama series.
9 years ago, Cheryl Dodson lost a friend to suicide.
So you blame yourself and you replay those moments in your mind. You try to think about what you could have done differently.
Now as the executive director for the Alabama Suicide Prevention and Resource Coalition, Dodson helps educate people in order to prevent suicides.
Oftentimes depression and anxiety will lie to you and say that you have no value, that no one cares.
The nonprofit equips people across the state through specialized training known as QPR. QPR stands for Question, Persuade, Refer. Dodson says the training is similar to CPR, but it's for mental health crisis.
So we're going to ask, we're going to listen, and we're going to get you some help. But prior to that, we learn warning signs, languages, behaviors, what to look for.
No one is immune from having a behavioral health issue or a mental health concern.
Suicide can impact anyone. In 2022, more than 49,000 people died by suicide. That is one death every 11 minutes. Beverly Johnson, director of Child and Family Services at the Alabama Department of Mental Health, says it is important to know the signs.
If an individual is having feelings of hopelessness, maybe having some mood shifts, being agitated.
Johnson says one crisis system of care we have in Alabama is 988. By dialing the number, people who have concerns as it relates to suicide, mental health, and substance use can get the help they need.
It places you in connection with a trained crisis counselor to be able to assist you, to be able to listen attentively to your needs, to be able to provide you with the necessary resources and or referrals.
The state implemented 988 in 2022. Since that time, over 90,000 people here in Alabama have made contact through the Suicide and Crisis Lifeline and been able to receive supportive services.
That number really demonstrates to us that there is a need.
And both Johnson and Dodson say it is important to remember that we can all play a role in preventing suicide.
You don't have to be a behavioral health professional to play a role and to be significant for someone.
Saying, I hear you, I see you, you can always talk to me, can absolutely save a life.
Johnson says if you have attempted suicide or lost a loved one to suicide, social connectedness is very important. It is critical you seek support. Rosanna Smith, WSFA 12 News.
The 988 Lifeline provides 24/7 free and confidential support.
You can also text or chat with the operators at that lifeline. We placed a link to other resources as well at our website, WSFA.com.